Hello everyone, good evening. I hope you are doing well. Today we are going to discuss a symptom that can be quite common. We will explore the different possible causes. Of course, this list is not exhaustive, and in any case, you should see a doctor if you have a medical problem, as I remind you each time. So sometimes people wonder, I have diarrhea, why? Basically, diarrhea can be viewed in two different ways. Either it's stool that is not formed, meaning liquid stool like water, or slightly pasty stool like mashed potatoes, or mucus or bloody mucus, meaning mucus with blood. The key is whether it's the consistency or the frequency that increases. When we have diarrhea, it can be chronic, meaning it has been going on for more than 3 months. It can also be from several weeks or just a few days. Diarrhea can be continuous, happening all the time, or there can be days off with diarrhea sometimes and not others. Usually the most common cause is infection. You might think, Dan, I ate something bad. And yes, that does happen. Viral diarrhea caused by rotavirus, norovirus, and many other viruses can cause diarrhea. These are often liquid and recognizable because they are water-like, accompanied by stomach pain, sometimes nausea, vomiting, which is called viral gastroenteritis. Sometimes you only have nausea, sometimes only diarrhea, or both. Usually after a few days, symptoms gradually improve once the virus is eliminated. Then there are bacterial causes of diarrhea. That's a bit more troublesome. There are many bacteria, I can't list them all, but some include Campylobacter, Yersinia, Shigella, the infamous Salmonella, Escherichia coli, etc. These bacteria can be contracted from poorly stored food, such as undercooked meat, undercooked fish, shellfish, improperly stored dairy products, and many other foods. Unfortunately, these bacteria tend to persist. They often cause mucus or bloody diarrhea. Until antibiotics are used to eliminate the bacteria, the diarrhea usually persists. That's why, if diarrhea continues, you should always see a doctor for stool cultures to check for bacteria and determine which antibiotic to prescribe. Sometimes this is especially important if it's been going on for a while and multiple treatments have failed. For viral diarrhea, treatment is mainly symptomatic. You give medications to soothe symptoms, eat easily digestible foods like rice, bananas, carrots, which can help with constipation. Hydration is very important. Usually it passes on its own or with simple treatments. Depending on the country, there are different specialties involved. Also, parasitic diarrhea is less common. It involves parasites, tiny organisms that can be contracted during travel or even locally. It's important to consider this if you come from a tropical or different region. Testing involves stool analysis, which can be more difficult because false negatives are common. The main causes I've mentioned are the most common, but sometimes false diarrhea can be caused by constipation. For example, people who are constipated with an accumulation of stool called fecal stasis, which can release waste products that irritate the colonic mucosa, leading to diarrhea. But these are not true diarrhea, they are based on underlying constipation. This is not so rare, and there are quite a few cases. Sometimes diarrhea can also be caused by inflammatory bowel diseases, either chronic or acute. For example, diverticulitis, which is inflammation or infection of diverticula, small pouches in the colon, causes pain usually in the lower left, similar to appendicitis but on the left side. It's often accompanied by fever and feeling very unwell. It can cause diarrhea. Crohn's disease is another example, characterized by painful diarrhea, often with abdominal pain, sometimes with fever. Diagnosis is usually made via colonoscopy, fecal calprotectin tests, or blood tests. Often it's diagnosed during a colonoscopy or through testing for hemorrhagic rectocolitis, which is another inflammatory condition that can be chronic and often involves bleeding. We should also consider metabolic causes. For example, hyperthyroidism, where the thyroid is overactive, can sometimes cause diarrhea. Other possible causes include medication side effects. Some drugs you take can speed up intestinal transit. We've covered the main causes, but there are others, though they are much less common. You can always look for them, but they are rare cases outside the normal distribution. So in any case, What should you do? Generally, you should adjust your diet, stay well hydrated, and see a doctor. Explain the type of diarrhea, how long it has lasted, and based on that, it will guide the necessary tests. Treatment varies. Bacterial diarrhea requires antibiotics, viral diarrhea is mainly symptomatic, and conditions like Crohn's often require specific treatments. Usually these are local treatments, either administered rectally or orally, sometimes involving corticosteroids or immunosuppressants, injections, etc. I won't go into detail here because that's the work of a gastroenterologist, but this gives you a general idea. If symptoms persist beyond a few days, more than a week, or even less, if dehydration, weight loss, loss of appetite, or inability to drink occur, you should see a doctor immediately. That's very important. Well, I wish you all a good day and good luck. Goodbye.